Okay. Now, the typical health benefits would be where a company gets a reduced premium because they're getting a health insurance plan for a group, and either they'll pass the savings along to the employee, or they'll absorb the cost savings for themselves, or share it with the employee. Again, there are tax advantages, there are cost advantages, but let's take a look at some alternative health benefits packages. Let's take a look at what they are, and then we'll take a look at them in a bit more detail. We have one alternative health benefits plan that businesses and agencies sometimes offer is self-insurance. Another one is a flexible benefits plan. Again, we're going to take a look at all these in more detail in just a minute. Another one is collective purchasing. Another one will be drug benefits management. We have health savings accounts. And we have wellness programs. These are six more common alternative health benefits strategies that businesses sometimes employ. Let's take a look at them in a bit more detail now. Now we'll look at them briefly, what they are, and then we'll look at just some basic pointers about them. First, we have self-insurance. Self-insurance is where a company insures its own risk. What happens is sometimes the premiums a company pays can be to compensate the insurance company for the risks the insurance company takes. Now, if a company believes that the risk is substantially lower, a lot of times the company might save money by insuring its own risk. Now, the insurance package that comes to the employee will be developed pretty similar to a traditional health insurance package. Specifically when determining what percentage the company might pay versus what percentage the employee pays. What happens is like this. The company will set aside funding to cover the cost of anticipated medical expenses. At times, the company might buy what's called stop-loss insurance. This is where an issuer will pick up the medical expense in the event that the expense exceeds a certain limit that the company determines they're able to cover. That the self-insured company determines that they're able to cover. Also, as an add-on to self-insurance, the company might elect to hire, these are more outsourcing companies. They're known as either third-party administrators or administrative services only companies. These types of companies basically process and audit claims. They compensate for the expenses, or they can administer just the overall plan, the overall benefits plan. Now, some key pointers with self-insurance. First of all, there's a higher level of cost control. Okay, the business is insuring their own risk. They decide what they cover. They decide the maximum coverage. They decide the deductibles. That leads into the advantage of flexibility, right? Because it's their own policy. They can decide to offer whatever coverage they want. Another perceived benefit of self-insurance, while this is a bit controversial, but it provides the company certain access to certain records. For whatever the reason might be why the company wants that access, again, one of the controversial benefits that self-insurance provides is certain access to certain medical records. The only thing is that there are a lot of regulatory issues regarding self-insurance. Okay, again, the laws and requirements will vary by state, by business size. There are certain capital requirements. There are certain licenses, certain business size, etc. But that's a basic overview of the alternative health benefits called self-insurance. Another benefit, optional health benefit, alternative health benefit that businesses or agencies might offer are what are called health savings accounts. Okay? What happens with health savings accounts are as follows. If the insurance company decides for whatever reason the company is a very risky proposition and they'll only issue plans with higher, very high deductibles. Okay? What happens is that the company, they'll only offer plans, they'll only offer low deductible plans for an extremely high premium. So the company might say, you know what, let's take a lower premium plan that has a higher deductible, and we'll offer the employees a savings account where they can contribute funds tax-free to cover anticipated medical expenses. Okay? So again, the contributions will be tax deductible, and the employee has a tax-free savings account where they can withdraw funds to cover or compensate in the event they have a medical expense that requires, a high payout because of the high deductible. Now, the only thing with health savings accounts are, again, there are regulatory guidelines. In other words, what constitutes a qualifying medical expense for withdrawal. And in addition, there are IRS limits, how much the employee is allowed to contribute. But that's the basic overview of health savings accounts. Next, we have what are known as flexible benefit plans. Flexible benefits plans are where an employer will offer the employee a list of benefit options that the employees can choose from. The choice of benefits can range from health to retirement to perks. Okay, we're going to use some, and then the employees go ahead and they design their own package. Now let's use some random examples just for this, just for simplicity's sake. Okay, let's say the employee offers coverage either for medical expenses associated with a broken arm, coverage for typical prescription drugs, or coverage for medical expenses associated with bronchitis. Okay, let's just use those random examples. Okay, now what happens is the employees will pick what benefits they'd like. Okay, let's say out of those three, the employee is allowed to pick two. Okay, they'll go ahead and pick what they like. So an employee, let's say, who never gets bronchitis wouldn't bother to take that option. Same as the employee who will only take, let's say, homeopathic or holistic medications, right? They're not going to take coverage. They're not going to take the option for coverage for typical prescription drugs. Okay? What happens is now is that the benefits package will be most relevant to the employees and their quality of life. In turn, this will maximize the efficiency and the impact of the benefits. Okay, first of all, the impact, again, because the employees will find the benefits that are most relevant to their quality of life. And at the same time, the business isn't paying for benefits that will never be used. So there's the efficiency angle and the impact angle. Now, there are some key pointers to keep in mind. That, first of all, when First of all, flexible benefits plan, especially when they include a health savings account or retirement packages, will be restricted by IRS laws. Same as a health, same as health benefits plan, same as whatever, same as retirement packages, but there are IRS regulations. And more specifically, not all associated costs are tax deductible. And second of all, not all tax deductible costs are exempt from all taxes. But this is a basic overview of the flexible benefits plans. Let's take a look at collective purchasing. Collective purchasing is where a group of businesses or agencies will join together for one large umbrella health insurance plan. It can be done for any form of health insurance. Now, the point, the agencies basically the agencies just say, look, my agency alone only has 100 employees. Okay, I'm going to join together with another 10 agencies that have 100 employees, and we're going to go to the insurance company and get one umbrella plan for one umbrella health insurance plan for whatever health insurance we decide we want to get. Okay. The pointers here are obvious. First of all, it spreads the insurance risk over a much larger base, right? So, for example, if in layman's terms, if Coca-Cola is if you see on the bottle of Coke that they're having a lottery, everybody that gets this and this code under their cap could go online and apply, put in their code, and then they're going to be entered into the lottery. What happens is, if they offer that lottery strictly for the state of New Jersey, the odds of winning are much greater than if they'd offer that lottery to the entire, all across America, right? So it's the same with insurance. The odds of the insurance company having to pay for expenses when the agency has only when the plan is covering 100 people, the odds are much higher than if they'd be covering 1,000 people. This automatically lowers the cost. This automatically lowers the premium that a company will have to pay. And then in addition, it gives the collective group, added bargaining power.